Acrivastine is an antihistamine medicine commonly used to relieve allergy symptoms such as sneezing, runny nose, itchy eyes, and skin irritation. It works by blocking the action of histamine, a chemical released by the body during allergic reactions. After swallowing the tablet, Acrivastine dissolves in the stomach and is absorbed through the intestines into the bloodstream. From there, it travels throughout the body and reaches tissues affected by allergies, especially the nose, skin, and respiratory passages. By blocking histamine receptors, Acrivastine helps reduce inflammation, itching, redness, and excessive mucus production. This leads to relief from hay fever, allergic rhinitis, and other allergy-related discomforts, allowing breathing to feel easier and skin irritation to calm down. Some people may experience mild side effects such as drowsiness, dizziness, dry mouth, or slight stomach discomfort. These effects are usually temporary and vary from person to person. Always use Acrivastine as directed by a healthcare professional and seek medical advice if symptoms persist or side effects become concerning.